Next tonight, how easy do you find it to book an appointment with your doctor? New research for BBC News shows the UK has seen its first sustained fall in GP numbers for 50 years.
Across Yorkshire, that picture is more positive, and the number of GPs has actually risen slightly since 2016. But some doctors still believe they're seeing more patients than they think is safe.
Well, our health correspondent Jamie Coulson has been to see how one group of GPs in York has recruited paramedics and nurses with additional skills to ease the pressure.
If you could just open your mouth nice and wide for me and say, ah.
After 19 years working for Yorkshire Ambulance Service, Lucy McGann recently changed roles to work in a GP practice.
Have you noticed any swelling?
The former ambulance paramedic has undergone additional training to become what's known as a primary care practitioner. Over time, as her skills develop, she'll be able to treat more and more patients who would traditionally have seen a GP.
I see acute on-the-day appointments, so anybody who's turning up with cough or colds, chest problems, ear problems, urine problems, and then over time I'll be able to see a lot more conditions. If symptoms develop...
Here at the Haxby Group of surgeries in York, 95% of on-the-day urgent appointments are now seen by clinicians like Lucy instead of a GP. The Haxby Group has 6 surgeries in York and 5 in Hull and serves 60,000 patients. Alongside the 41 GPs, there are now 25 advanced practitioners, who include nurses and paramedics who've undergone additional training. The Haxby Group was recently rated as outstanding by the Care Quality Commission, and the creation of these new clinical roles, which means that patients have been able to get the right care at the right time, was one of the areas that was highlighted in the report.
Hello Mrs McAvoy, it's Anthony from Haxby Surgery.
Anthony Stones became a primary care practitioner after more than a decade as a paramedic.
So what seems to be the problem today?
He's one of only 8 paramedics in the country qualified to prescribe medicines. He sees patients at home and in the practice.
We do occasionally get patients coming in saying, so what do you have to do to see a doctor around here? But by and large, patients are happy to see primary care practitioners. I'm able to explain my position, explain the training that I'm going through and the experience I have, and they leave happy that they've been looked after.
If patients are seeing competent clinicians that they feel can manage their problems and they're seeing them in a timely fashion, then they're happy. I guess our role is to make sure that these clinicians are supported, they're trained to the level that we feel they need to be trained at.
I'm up.
Marvellous.
Developing these types of role in GP practices is a key part of the NHS long-term plan for primary care. In future, it may not always be a doctor who will see you now. Jamie Coulson, BBC Look North.
Take care. Bye-bye now.
Bye. Thank you for coming.
We're joined now by Dr Youssef Bini, who works as a GP in Bradford. Welcome. Many of our viewers will be concerned by the drop in the number of GPs that we've heard about. Is this the way forward, paramedics and nurses helping them?
I think it's an excellent opportunity. We know that in healthcare the work can be divided safely and effectively between a multidisciplinary team, both in primary care and in hospitals, and there's a lot of experience and evidence that that's very, very effective, and we're finding that very useful in our practice. We've been using advanced nurse practitioners for many years, and they are, I would say, some of them definitely better than me.
We watch these TV programmes about the ambulance service. You can't get a paramedic, so how's that going to help?
It's when we've advertised for some of these posts, there's actually been a tremendous amount of interest. So I hope we're not stealing them from anywhere else. But there does seem to be a fantastic interest. In our local job advert for physician associates, we had 10 times more applicants than we have had posts.
We're hearing from some GPs who say they've got double the workload, twice as many patients as they should be seeing, and it's not safe. What are your thoughts on that?
Well, I say to my trainees when they come through, when they first come through, it is a very, very busy job. When I was younger, I had hair like David Ginola. I now have no hair, I'm grey. It is a stressful job, there is no question. You can feel it on the front line every day. There is a tremendous amount of stress. It often feels like firefighting. You want to do the best for the patient. We care about our patients, and we struggle, we really struggle. You have to just cram so much into a day. And so we have to think about alternatives, and we have to get better. We can't just accept this.
Is it safe to be seeing so many patients in a day, cramming people in there, people with very complicated conditions often, who need the consistency of the same doctor?
Yes. We've got perhaps two aspects to it. You've got safe, and then you've got optimal care. At the moment, we are, I feel, in our practice, operating safely, but we are definitely not doing the best for our patients. Long-term condition patients, diabetes, heart disease, they need a holistic, detailed assessment, not just, oh, you've got a chest infection, off you go, and not dealing with all the other things that are going on in their lives, to try and maximise their health. And so, yes, I totally agree.
Okay, thank you very much, Dr. Youssef Bini. Thank you for joining us.
Thank you, thank you.